I don't know how to talk about it without being like too over the top. Because the help provided by the Stone Clinic, like from every aspect, from the front desk to just everyone here, they're extremely helpful, extremely friendly. They genuinely have the patient's best interest in mind, and that shows as you make your way through from the doctor to going back to doing physical therapy, working with the nurses. So my initial injury was prior to the military, but after 8 years in the infantry and rucking and running, I eventually got to the point where I had pretty sufficiently destroyed my left knee. So I went to the doctors, and their diagnosis was that my left knee was destroyed by that point, and that I needed to look at an artificial knee replacement sometime 2 to 5 years down the road. So I researched Dr. Stone on my own, presented that information from Dr. Stone after an online consultation, and the military doctors, for the most part, didn't want to hear it. For 18 months, we worked on them, worked back and forth, trying to find someone who was supportive of the procedure. And once we did do that, then we finally got approval for surgery. Prior to surgery, I had spent a year on crutches, trying to preserve what I had, so that surgery with Dr. Stone was my goal. So I wanted to preserve what I had. I didn't want to pursue the artificial route. I had the meniscus transplant with the pacecraft. After surgery, it was almost, it was definitely weekly. It felt like daily. I saw progression and improvement. It's a huge encouragement to talk with Dr. Stone. He wants to see the patients progress, both in their disposition as well as in their physical, whatever's bothering them physically. He wants to see them progress through both of those issues. PT couldn't have been better. Best PT that I've had, manual therapy through Trish here in the office. Hands-on, continues to push you, but in a way that is respectful of where you're at. So I can't speak highly enough of the physical therapy department. They were extremely helpful. Where I'm at now versus 6 months ago. 6 months ago, I was staring at the end of a military career, and I didn't know if I'd really be able to walk again. Now, not only can I walk, I don't know where my limits are going to be physically, but they're much further than where I was at before. I have the opportunity to go back to work and be productive again, and that's extremely encouraging.